Hi, so I'm going to talk about posture today and how important the posture is. Tony Robbins says that at the beginning of all his seminars that if you were to imagine I have somebody backstage who is depressed, now what would their posture look like? Well, the head would be down, shoulders forward, kind of like that. That's kind of this depressed posture. Well, that's the posture I'm seeing every day in my office, but out on the street as well, and especially with our teenagers. And I have a lot of concerns about that at this time. So I just want to briefly show you the spine and refresh your memory if you didn't watch the other videos. Our spine has three main curves, and these curves act like springs to suspend the weight of our head, and of course our mainspring is our feet. But our neck curve, our cervical curve, is developed when we first are born and we start learning to hold our head up as a baby, because in the womb we don't have all these curves. We only have the one curve. It's called the C curve. So we start holding our head up as a baby to suspend the weight of the head. This curve stays here, and then when we start walking we start developing this curve. Now these curves are to enable us to walk upright and to keep our weight balanced so that we can run, walk, move around, and so forth. So what happens when we start losing these curves is we start losing our ability to respond to our environment, and it literally affects our emotions as well. It literally is a depressed curve, and we see that a lot in today's teenagers. So if you have teenagers, if you have kids, I want you to pay close attention to this. Because I'm a writer, I do sit a lot, and I became even more acutely aware of this, even though I'm a chiropractor, after I'd written my second book, because I started developing neck and shoulder pain and low back pain, and it was because I was actually losing these curves. I was beginning to develop this sort of a posture, if you can imagine me at a computer. So I'm going to demonstrate with Kelly how these curves work and what happens when we lose them. So as she's standing, she has a nice erect posture. She has a normal forward curve in her neck, a normal backward curve here, and a normal forward curve in the lumbar spine. That's as it should be. But she's going to show you what happens when she does not have these curves. So go ahead, and her head goes forward, shoulders roll forward, and you start losing this lumbar curve. Okay, you can stand up. So I'm going to show you what I have teenagers do, mostly teenagers, sometimes adults do. It's a little simple exercise in awareness, and it also strengthens the posture and brings the posture back into an upright position. So I'm going to use a broom handle. Most of you have these around the house somewhere, and come on over here, Kelly. So we'll turn around and we'll go all the way to your left. So she's going to hold one hand up, one hand here, right along her spine, and we'll turn this way a little bit. And go ahead and have your normal posture. In a normal posture, you should be able to touch your head to the back of the broom handle. The back, the middle back should touch the broom handle here, and this should hit your sacrum. That's right down at the bottom of the spine here. So go ahead and assume the slumped posture. Okay, in a slumped posture, this is what will happen. Some of you notice when you're driving your car, your head doesn't touch the headrest, or it doesn't even come close. So what I have people do is put their head back initially. So go ahead and put your head back and to touch the pole. When she does that, you'll notice she's looking up, and that's what they do when I have them do that. So what we do is we push their shoulders back. When we push their shoulders back and their head is still touching, now they know what a normal posture feels like. And I have them walk around 5 minutes a day holding this broomstick like this, and the awareness really comes up of what the posture they should have. So only 5 minutes a day. It works wonders. It's awesome. Okay, so next time we're going to go over some exercises besides this one, to actually improve your posture and improve your mood at the same time. Thanks.